All right, hello. My name is Holzworth, and this is my practice recording for my seminar presentation featuring my dog Gracie. I'm just going to start my presentation, give about 3 to 5 minutes just as for the practice, and I am using Screencastify. So my presentation is about inhaled loxapine treatment for acute agitation. The learning objectives are to list the current therapeutic options for treating acute agitation, to explain the benefits of using inhaled loxapine for acute agitation, and to identify the type of patients that would be appropriate candidates for inhaled loxapine therapy. Some statistics about acute agitation are that 1.7 million individuals will present to the emergency department during episodes of acute agitation. In 2011, a survey found that 78% of emergency room physicians and residents reported some form of workplace violence in the past year. Acute agitation itself is not a disease state, but it is a symptom of a variety of medical and psychiatric conditions. And in the realm of psychiatry, acute agitation can be defined as verbal and/or excessive verbal and/or motor behavior. That behavior can be described as loud, disruptive, hostile, threatening, or combative, and acute agitation should be considered and treated as a psychiatric emergency. There are 6 goals for treating psychiatric emergencies. The first is to exclude medical causes of symptoms. The second is to rapidly stabilize the acute crisis. The third is to avoid coercion. The fourth is to treat in the least restrictive setting. The fifth is to form a therapeutic alliance. And the sixth is to ensure appropriate disposition and aftercare plans. Acute agitation scales will be seen later on throughout the clinical trials that we will discuss. So the first is the positive and negative syndrome scale. It's 30 items specific to schizophrenia, rated from 1 being absent to 7 being extreme. And there's also the excited component, which has 5 items specific to agitation. Next, we have the Clinical Global Impression Scale, which analyzes the severity of illness, and the Global Improvement from Baseline, which I will discuss later. Here's the visual depiction of the PANSS and all items that go into it, and the 5 items that belong to the excited component. And here is the Global Impression Scale, which includes the severity of illness, which asks the clinician how severe the patient's agitation or illness is at that moment in time. And that scale is assessed from 1 being normal or not ill to 7 being among the most extremely ill. And the global improvement asks the clinician how much a patient improved from baseline to post-treatment. So hopefully that's enough time for an adequate trial of the practice run. Don't worry, in my actual presentation, I will not be holding my dog. Just wanted to get a practice video to make sure that everything is submitting correctly. So thank you.